One of the conditions that we see here is something called toxic brain injury. Substances such as carbon monoxide, chronic methamphetamine use, chronic cocaine use, chronic alcohol use can cause a diffuse pattern of brain injury, which again is not readily apparent on standard CT or MRIs, but which is discernible on functional brain imaging.
Now, we all know about carbon monoxide, and we usually hear about people trying to commit suicide because of carbon monoxide. It really has some very defined physiological markers that occur, and it by itself ends up being a very definable disorder.
Toxic brain injuries are more prevalent than we thought. There was a study done in Southern California in which 2,000 consecutive admissions to an emergency room were tested for elevated levels of carboxyhemoglobin in the bloodstream, and it turned out that 2% of the individuals, or 40 individuals, had toxic levels of carbon monoxide.
I'd argue that CereScan may be the leader in the world. They certainly are in the country, combined with Dr. Greg Hipskin in the identification of the severity of that carbon monoxide or other toxic gas poisoning. And at CereScan today, we're able to very definitively see the impact of carbon monoxide and other toxic gas exposures to help that patient go to the right treating physician.
A lot of times people that come to us have been through a lot of treatment options. They've gone to different doctors, they've had different diagnoses, they still have the same symptoms, they've tried medications. What we do is we give them a definitive answer of what's going on in their lives.